1,000 workers across Massachusetts. SEIU was a leading force in winning the pioneering healthcare reform legislation in Massachusetts in 2006. Hundreds of thousands of families now have health coverage and no longer have to worry that an accident or an illness will threaten their livelihood or family. With the nation posed to take up this battle to win healthcare for everyone in America, what lessons and strategies do you have to share about building a powerful grassroots base for healthcare?
Thank you very much for the question, and thanks for having me here today, and thanks for joining us all here at our office. I'm glad we can offer the space, and it's been a great resource for us, and lots of other campaigns and community meetings here that we've been able to host, and we're glad to be able to be here with you all today. And clearly, 1199 did play a big role in fighting very hard for reforming our healthcare system here in Massachusetts and making sure that everyone had access to good quality, affordable healthcare, but clearly could not have done it alone, and there was lots of organizations that were critical players with us. And one of the key lessons that we learned through this campaign is that you can't just do it alone. You have to build not just community support, but you have to build coalitions with other like-minded organizations and individuals that are willing to take the fight hard with you. Organizations like Neighbor to Neighbor, that I know Wanling was up here before, was an instrumental partner in that campaign, and Healthcare for All and other consumer rights groups that really brought together a broad-based coalition that really organized not on individual, particular, specific policy positions, but rather a core set of principles. And I think that's one of the key lessons that we learned through this process, and clearly from some of the information I read in the packets handed out today that the president and this organization has taken on as well, is that really get to bring people around a core set of principles and beliefs. That if we get caught in having conversations and trying to figure out amongst ourselves the individual, in particular, very complex issues, then we're going to have a long conversation before we have the opportunity to take some action. So I thought that that's exactly what we did here in Massachusetts, is we brought together providers, hospitals, community groups, unions, and others to make sure that we all believed that there would be a set of criteria that we would evaluate any bill that passed to make sure that it met a certain standard in order to organize and work together, which I thought we did. So, being able to organize grassroots power to have change on a multifaceted, multidimensional campaign like healthcare reform is possible if you do it and do it around some sort of principled approach. I think also what we learned from this effort was that grassroots power and mobilization can hold elected officials' feet to the fire when it's hard. There's so many ways out of making tough decisions. It's always an easy thing is to not take action when there's difficult questions that have large impacts like reforming healthcare does. But I think with the knowledge and the elected officials knowing that there's an organized group of individuals that is not going to let this issue die or go away, that it's not going to be an easy way to let this go, that we're going to be out there in the public, we're going to be pushing a message, we're going to be rallying the state house, we're going to be calling our elected officials, we're going to hold their feet to the fire to make sure that they continue and make the tough decisions and keep treading on, and just holding that pressure, just that thought that we're out there and we're organized, really urged them, encouraged them that they had to do something, they couldn't step aside. So I think that's a critical lesson that we learned in this campaign here in Massachusetts. And I think also that just having an organized grassroots message and strength really does bring everyone a seat at the table when decisions are being made. May not physically be there, but the thought and the decision makers, when they're there figuring out how to put this thing together, realize that there's an organized group of citizens and voters that are going to evaluate this and want things to be included. And so even though we're not in the Speaker or the Senate President or the Governor's office actually making those decisions, they have to think about what's the impact their decisions are going to make on the people that are organized and what's their reaction going to be to this. So I think having an organization like that brings you into rooms that you may not necessarily physically be in, but are being thought of when decisions are being made. And I think Jeff, in his video presentation, really laid out a key part too of what we learned here in Massachusetts, and that is the message that's being delivered. And not only what the message is, but who delivers that message. A key part of our campaign was making sure that employers took responsibility and, one, kept coverage of individuals, but also contributed to the cost of offering subsidized plans to the state. And we didn't get everything we wanted out of that, and that fight's going to continue. But we really use organizations like Neighbor to Neighbor and 1199 and Healthcare for All to hold their feet to the fire and show that consumers are out there, will be in front of Friendly's, be in front of McDonald's, highlighting the impact of bad healthcare and what it means for their employees. and what the state should do in order to have a little bit of a higher standard than some of these employers and what they can do. So I think it's not just what the message is, but who delivers that message, and that has a lot of symbolism and goes a long way for individuals. So I think those are some of the key lessons that we've learned here in Massachusetts, and clearly are being applied nationally to this campaign as well. And I can just see by some of the materials here that it looks like people are moving right along and have taken a good start. And healthcare reform is clearly happening on a national level, and it's happening quick. So I'm glad everyone's here today to start the conversation, because there's definitely a commitment to it. And even reading today's paper, everyone talking about that the inevitability factor that this is going to happen. I think knowing that it's inevitable means that we need to be organized and focused, and making sure that the principles on which everyone came around together around for the Barack Obama campaign are applied to what comes out of Congress, and finally sign into law and hold, and make sure that we have all the principles that we all care about are included in that final piece of legislation.